The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody, and welcome to the National Hispanic and Latino Mental Health Technology Transfer Center's first webinar. The Hispanic Latino Mental Health Technology Transfer Center is one of 13 centers recently established by the Substance Abuse and Mental Health Services Administration, known as SAMHSA, to build capacity and provide technical assistance to better serve those in need of high-quality mental health service. It is also one of the only two national level technology transfer centers, or TTCs, serving specific populations, in our case, Hispanic and Latino populations. So if you need any more information about us, you can email us at hispaniclatino.mhttc@uccaribe.edu. So today's webinar will be presented by Dr. Leopoldo Cabassa, Associate Professor at the George Warren School of Social Work at Washington University in St. Louis, and I will tell you more about him soon. So as I mentioned, the National Hispanic and Latino Mental Health TTC is part of a network developed by SAMHSA, which includes the Addiction Technology Transfer Centers, the Mental Health Technology Transfer Centers, and the Prevention Technology Transfer Centers. The purpose of this program is to develop and strengthen the specialized behavioral healthcare and primary healthcare workforce that provides substance use disorder and mental health prevention, treatment, and recovery support services. So during today's webinar, all participants will be muted and the audio will be streamed through your computer. Please make sure your computer speakers are turned on and the volume is up to hear the presentation. I'm going to review a few housekeeping items with everyone. If you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located on the top right corner, indicated by the red arrow that you see on your screen. Now you'll see that your viewer is expanded to fit the entire screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow on the left of the toolbar. And then click the arrow again to expand the toolbar. As we move through the presentation, if you have a question for our presenter, we ask that you use the chat box that's on the toolbar. Simply type your question and hit send. So what we're going to do is that after Dr. Cabassa finishes his presentation, we're going to allow at least 5 to 10 minutes for questions and answers. If there are any questions that we don't have time for to complete the answers, what we're going to do is that we're going to include them on our website later on. So a recording of today's webinar will be available at our YouTube channel, and you see the address over there. It's YouTube/nat_HispanicLat_MHTTC. So I'm going to take a moment to explain a little bit more about our center. The Mental Health Technology Transfer Center network is technology transfer, disseminating and implementing evidence-based practices for the treatment and recovery of mental health disorders, in our case, for Hispanic and Latino populations. As I mentioned, we are funded by SAMHSA, and our network includes 10 regional centers, a National American Indian and Alaska Native Center, and of course the Hispanic and Latino Center, and a network coordinating office. Part of our efforts include the development and delivery of educational training events in person, virtual technical assistance sessions and webinars to impact organizations serving Latino communities, assisting programs in identifying facilitators and challenges as they pertain to the implementation of specific practice improvement towards mental health service for Hispanic populations. So again, if you're interested in any of our services, you may contact us at hispaniclatino.mhttc@uccaribe.edu. So SAMHSA strives to reduce the impact of substance use and mental health disorders in the United States communities through its programs and services, and demonstrates that behavioral health is essential to health prevention works, treatment is effective, and people recover from mental health and substance use disorders. If you want to learn more about SAMHSA, you can visit their website at www.samhsa.gov. Okay, so now I'm going to introduce our presenter, Dr. Leopoldo Cabassa. Dr. Cabassa, as I mentioned, is an associate professor at the George Warren Brown School of Social Work at Washington University in St. Louis. He's also the director of the T32 NIMH training program in mental health services research at the Center for Mental Health Services Research at Washington University. His research blends quantitative and qualitative methods, implementation science, intervention research, and community engagement to examine health disparities among racial ethnic minorities with serious mental illness, and also inform the development and implementation of interventions to reduce these health inequities. Dr. Cabassa has published in leading journals in the fields of social work, mental health services research, public health, implementation science, and health disparities research, and has attracted external funding from the National Institute of Mental Health, the National Institute of Minority Health and Health Disparities, and the New York State Office of Mental Health. His long-term career goal is to establish a program of research and training that focuses on understanding the factors that fuel inequities in health and mental health care, and uses knowledge to inform the adaptation and implementation of interventions to reduce disparities. So, I'm gonna pass over the controls before that. We're gonna do a brief poll questioning. So let's start with that. For our audience, do you currently serve Hispanic and Latino populations with any serious mental health disorders? And 83% of our participants say yes, 16% say no. Do you currently serve Hispanic and Latino populations with, no, we already did that one. Are you planning to serve Hispanic and Latino populations with any serious mental health illness in the next 6 months? So we have that 89% of our participants say yes, 3% no, and 8% don't know. What is your current professional role? So among our participants, we have 21% social worker case manager, 33% counselor, therapist, or psychology, 13% faculty research student, 8% government official policymaker, and 28% other. What type of setting do you currently work in? So 13% academic, 39% treatment, 3% research, 27% government, 18% other. So now we're going to go to our pre-post questioning. Stigma is specific to individual cultures. Yes or no? True or false? And our participants say 53% say true, 51%, and 49% say false. So for our next question, stigma only impacts help-seeking behaviors. Okay, so 97% say false, 82%, and 8% say true. For our last pre-post questioning, Latinas in need of mental health care are more likely to underutilize mental health care. And 100% say true. Okay, so that's the end of our questions. Now I'm going to turn over the controls to Dr. Cabassa so that he can begin his presentation. So here we go.
Excellent.
Okay.
Do you see my screen, Darisa?
Yes, I can see it. Yes.
Perfect. All right. Good morning. Buenos días y buenas tardes a todo el mundo. It is a pleasure to be here. As Darisa mentioned, my name is Leopoldo Cabassa, and I'll be presenting today some of the work that we've been doing on improving depression literacy and reducing stigma in the Latino community, and really trying to figure out how to disseminate and use culturally appropriate tools for these big challenges that we'll see. And as Darisa mentioned, we'll go through the presentation and then take questions at the end as we go through. So let's get started. So I want to start with sort of a story and sort of what motivated us to do some of this work. This is basically a quote that we heard from a study we were conducting many years ago at a primary care clinic, actually in LA, and we were providing services for Latinos, mostly of Mexican origin, who were having diabetes and depression. And our job was to really provide evidence-based practices for depression in primary care settings. And this came from a participant who had concerns about disclosing that she was receiving care for depression. In particular, she was taking medicines for depression, and disclosing that to other people because she was afraid that they would call everyone in their family crazy. And this really raised an issue for us and highlighted some of the stigma and taboo that exists in the Latino community, in our community, around depression and depression care. And that even in people who are engaging in care, this is someone who was receiving treatment for her depression, the stigma was still present and impacting sort of her life and her social world. So we really wanted to understand this phenomenon better and actually develop tools for these type of things over the course of our study. So first of all, let's start with some basic definition. What is stigma? So stigma is a word. It's a word that derived from a Greek term, and it actually refers to a mark of shame, a tainted or discounted. It is something that every culture that exists in every culture. Every culture stigmatizes some other group or some other individuals, but it is linked to different types of unfavorable attitudes. So stigma influences how people view themselves. It influences attitudes, beliefs, and stereotypes. And the impact that stigma has on someone is that it results in being devalued, excluded, and discriminated against. And as we will see, stigma influences different aspects of the health-seeking process and all along the health continuum. And it's a big barrier that prevents people from seeking, engaging in care as an important component. But like any other time, we need to think about the key assumption that stigma has. Stigma happens in social interactions. It happens in the conversations people have with each other, in the interactions people have with one another, how they name and understand situation. As I mentioned, they're linked to numerous negative consequences, from poor self-esteem to all the way, as we will see, on treatment outcomes. And stigma is both universal, meaning it exists in every culture, but the way it is expressed, what is actually stigmatized and what is actually understood as something, as a stigmatizing condition, is very specific to individual cultures. So it has this both universal and a specific component to cultural aspect, and that's why it's important to understand it and then use that information to develop better interventions to address this important barrier to care. So in the work that we've done, we've identified that stigma actually impacts the entire pathways to care, from recognizing that you have a mental health issue or mental health disorder, all the way to engaging and actually to the outcomes of care. And I'll show you some evidence that exists along all of these components of the pathways to care and what we know, particularly in the Latino community. And although there's been few studies, as you will see on this on this topic in the Latino community, the studies that are out there are very suggestive that this becomes a really important barrier to address and something that can be modified via interventions, and an important step of engaging our community in depression care. So in terms of illness recognition, actually we conducted a study many years ago in a primary care clinic here in St. Louis, Missouri, and in which we actually recruited a group of Latino patients in this clinic, around 95 Hispanic immigrants, mostly of Mexican origin, and presented them a vignette, basically a story of someone who was going through a major depressive episode. And then we asked them what they thought of the vignette, what they thought of that individual, and what would they do if they knew someone. And we've published this paper in the Journal of Immigrant Health, and what we found was that around 45% of the people we talked to did not identify the person as depressed. Even when they could identify all the different symptoms of depression, they did not use the word depression to identify the person. When we asked them about what they thought the person was going through, they attributed the situation to social problems, not to a mental illness. So the person having marital problems, having social issues, having problems in immigration or with work, but they actually didn't identify it as a mental health issue. And then they view the situations as something serious, but that will pass quickly, that would improve with time. And many people mentioned that it could be controlled by the person without treatment. So even if they thought this was a serious situation, people really didn't mention seeking help or professional help for this situation. So we're beginning to see how illness recognition influences some of these components. Another important element of the stigma is the views towards psychiatric medication, in particular antidepressant medication. And here there have been several interesting studies across the United States looking at different Latino groups using different types of methodology and finding similar patterns around this particular issue. Mostly that Latinos tend to view psychiatric medication, antidepressant medications, as addictive and harmful. They have this fear of dependency or loss of control, that if they take this medication, they will be dependent upon them to function. Many consider it as a band-aid solution. And given that a lot of these studies were conducted in primary care, people were concerned about taking another pill for another problem and not wanting to add more medications to an already complicated medication regimen that people have. People did talk about feeling drugged or numb because of this medication. And then that taking the medications, as we saw earlier in the presentation, was a mark of social deficiency, that medications are only for people who are very severe or locals, and for people who cannot or are unable to cope with stress. So these views of medication become really important. And to us, this is a critical element, given that sometimes the first line of treatment that we can offer people with depression is a psychiatric medication. So not understanding these views that people have become really important, and how to have conversations around these important attitudes and beliefs of psychiatric medications. Another element that has been understood is that stigma not only impacts seeking care and illness, it also impacts actually different aspects of depression care, and in this case, actually engaging in care. And this is a very interesting study and a very rigorous study that was conducted by Vega and colleagues published in 2010 of 200 low-income Spanish-speaking Latinos in primary care who were identified with depression and then were receiving care for their care. And what they saw here was that people who have high levels of stigma, based on a measure of different aspects of stigma had lower odds of actually taking the medication, lower odds of actually managing their symptoms, and higher odds of missing appointment. So stigma became a really big barrier of engaging in care. In a follow-up study, we also saw around 220 Latinos, again in primary care. Interian and colleagues actually examined the relationship between stigma and the impact that it has in outcomes of care. And what they found is that the average PHQ scores across the time for Latino, they compared those that have high levels of stigma and low levels of stigma. And the results indicate that stigma score had the strongest relationship to the trajectory of PHQ-9 scores. That meaning that people who have high levels of stigma tended to have a longer time with depression, and actually stigma was related to depressive symptom persistent. So over time, people were now getting better, particularly if they have high levels of stigma based on this measure. So what we're seeing is that stigma influences different aspects of care, as well as engaging care and some outcomes of care as well. As it was mentioned in the poll, and actually 100% of you got this correct, so I'm not going to belinger at this point, that there is great evidence, and actually it's well-established evidence that Latinos, adults in need of mental health care, are more likely to underutilize mental health care, discontinue treatment prematurely, and when they do receive care, it tends to be of poor quality. And this is for common psychiatric disorder like major depression. And the consequences of this disparity is that mental health care contributes to greater persistent severity and burden of mental disorders, so more disability because of these inequities in care that our community is experiencing. And this has been a well-established evidence from multiple studies, both clinical as well as epidemiological studies, and as well as longitudinal studies examining service use patterns in the Latino community. So what we know thus far is that Latinos report similar high levels of public stigma when compared to other groups. There is evidence of low levels of illness attribution or of identifying a mental health condition when one exists. There are serious apprehensions towards psychiatric medications that could influence people's engagement in this care. And then as we saw, that stigma negatively impacts different aspects of treatment, from engagement all the way to outcomes. So based on this evidence and based on what we have known, our group several years ago decided to develop some tools that can be used to address some of these major issues, these apprehensions to medication, improve illness attributions, and hopefully engage people so that they can seek care when they're feeling depressed or experiencing depression. And so what we did, we developed this depression fotonovela, which is basically what you see here. It's a comic book type of pamphlet that basically tells the story and engages people in an entertaining story that as you're reading and examining this story, you're also getting information about depression. So you have here, an attractive title that looks at secret feeling. It doesn't say depression anywhere. It entices people to pick it up since there's some free stuff inside. And then it tells basically a soap opera narrative story, an entertainment story that's going on with these individuals. But as the person is reading and engaging in this material, they're being exposed to information about depression. I'll give you some examples and some ideas of why this is why we did it this way. So one of the key components was we wanted to increase knowledge. So we wanted to help people understand what are the real symptoms of depression, understand that they can recognize depressions in themselves or in others. They want to learn about different treatment options. We want to expose them to different options that people have when they're feeling depressed, and then where and how to seek for professional help. And actually one component here is that people use the word depression. We wanted them to disclose to professionals if they're feeling depressed, that they use the word depression, estoy deprimido, estoy deprimida, as an important aspect of seeking care. We also wanted to reduce stigma, that stigma that we have found in the literature around myths of antidepressant medication, that depression is not a social deficiency or a character flaw, that depression is a real medical condition, and that treatments work, that they're not only for people who are very severe. Treatment actually works for everyone, and if it's accessible, people can actually benefit from that treatment. So we wanted to address some of that stigma within this narrative. And then we want to model help-seeking behavior, model how friends and family members can provide emotional support and encourage someone that's feeling depressed or experiencing depressive symptoms to seek help. We wanted to model proactive, positive health-seeking behavior, things people can do to actually seek help, and then show and discuss different treatment options, the benefits and the issues with psychiatric medication, as well as the benefit and the difficulties of counseling, and making sure that people got different options for that type of care. All of this is actually based on a health communication approach called entertainment education, which is a strategy that embeds educational messages in popular entertainment media. And there's a whole literature on health communication using this approach. And the idea is that the goal is that as you're being entertained, then you set the stage for people to change their attitudes and behavior. As you're being entertained with the material, your defenses or counter-arguing with the information you're being exposed to actually reduces, and it provides a better foundation for the educational messages to help the individual and hopefully to engage in some health behavior change. And there's some great literature around this on this type of approach that's been done for multiple health conditions, not only for mental health. We also wanted to make sure that the intervention was culturally relevant, and we wanted to make sure that we are addressing critical aspects. And for us, this becomes really important, because if an intervention is not culturally relevant and you don't pay attention to cultural elements, you might run your intervention into an iceberg. There's a lot of different things that need to be considered. So we wanted to embed it with cultural aspects. So in terms of the language and the literacy level, for example, this fotonovela is available in English and Spanish at a 4th grade reading level. It has this look of Latino look and flavor. It uses Latino characters. It uses Latino expressions and language. But at a deeper level, it also embeds the narrative in a family context, in the idea of how depression not only influences and impacts the individual, but also ripples and influence and impacts the family. And then we targeted very specific attitudes and stigma that we know from the literature are unique to the Latino community, and that is an important aspect to address. So this whole tool also has a conceptual model to it. So we're not only interested in developing a tool that can be used, that looks good, and that might be useful, but we also wanted to examine in more detail and evaluate sort of the research and the assumptions that we're making as we're using this tool. So we have narrative characteristics, which are the cultural elements that I mentioned, in order to develop engaging characters, an engaging story, a story that feels realistic to our audience, that entertains them as they're being educated, and also that it appeals to them. And the idea is that by doing that, we're creating a narrative that transports people, that touches people, that people feel they relate to, they can identify with the characters. And then more importantly, they want to share what they learn with someone else. That social proliferation is what we call, once people get exposed to the fotonovela, they want to tell someone about it. They want to share it with a family member, with a friend, with a colleague. We call it sort of the water cooler effect. You learn about something, and then you want to tell someone about it so that you can disseminate it to your social network. And that what we're hoping is that it influences or have positive outcomes on self-efficacy. Persons feel more confident in recognizing the need for treatment. It increases the knowledge of both symptoms and treatment, and then hopefully reduce stigma. And then that will have impacts on health behavior, like help-seeking, treatment initiation, and engagement. So this whole development actually was developed with a lot of community input. We as researchers didn't do this by ourselves. We actually had a great team at the University of Southern California when we did this, in which we brought in many stakeholders to help us develop the storyline, develop the characters, develop the messages, and it was informed by both clinical observation, research in health behavior theories, and then community input, community members, clinicians, actors, and all of this helped us develop a sort of a script development. We wanted to develop a tool, as I mentioned, that is relevant, that is engaging, and that it really speaks to the community. And then we evaluated, as you will see, the impact that this fotonovela has in multiple ways. So the first evaluation we did with this was actually do focus groups. We presented this in adult education classes, actually programs in LA, for around 32 individuals, and we conducted some focus groups with them. These are people who are out in the community who are participating in adult education programs, GED, ESL classes in East Los Angeles. And then we did focus group, two in English, two in Spanish, since we wanted to make sure the people's reaction to the tool. And then we analyzed that data based on those discussions that we have with them. And these are all adults 18 years or older. And what we found is that people did like the educational value. They found it easy to understand and entertain. They saw that the story was realistic. Things that they didn't like is that we had used color in our title page, but then we used black and white to save some funds. They wanted more details about recovery. And an important finding is that when we asked them about the use of antidepressant medication, people actually doubted what we were saying. So people mentioned, that's great, you're telling us antidepressants are not addictive. We get it from the story, but we don't believe you. We don't think that's true, and we have stories where and know people where they become addicted to antidepressant medication. So that actually taught us a lot about some of the limitations of this tool. That this Fotonovela is not going to solve everything, and there's issues that need to be addressed more deeply in other ways. People did talk about learning about symptom recognition, help-seeking options, and reduce stigma, and they did want to share the Fotonovela with other people. So qualitatively, we began to see that the Fotonovela was actually activating those narrative mediators that we have included in our narrative. There were people feel engaged by the story, they identify with the character, they felt the story was realistic with some limitations, and they wanted to share that story. So we took this evidence even further, and then we did. There's been several randomized controlled trials that people have used, our team as well as other teams have done to examine the impact of the Fotonovela on different outcomes. So not only do we have qualitative data indicating sort of the value of this particular tool, then we use more rigorous methodologies to examine the impact that the Fotonovela has. And I think this is a really important component because this is really putting to test some of the assumptions that we brought into this, and to see if these types of tools actually work to address the issues that we're trying to address with this tool. So there's been two controlled randomized trials. One was in LA County, led by Jennifer Unger from the University of Southern California, and the other one was actually a doctoral student at UC Berkeley, Maria Hernandez, with her mentor Kirk Organista, and they tested that in community clinics in Oakland and in San Francisco, and we tested ours in South Central LA. And there's been several publications we've done from this. So what we found actually, and there's been some consistent finding between these trials, and it's been important to do it because they've been able to replicate the original findings and being tested in different Latino groups, is that compared to a control condition, we compare our Fotonovela to a regular brochure. In fact, both studies use the National Institute of Mental Health brochure, which is a really useful tool for informing people about depression, but it doesn't use the entertainment or the narrative aspects that we use in ours. And what this trial found was that compared to control condition, secret feelings, our Fotonovela significantly improved knowledge of depression and knowledge of depression treatment. So knowledge about symptoms of depression, how to recognize them, and also knowledge about where to go for depression care. In Hernandez study, actually, they found impact on self-efficacy, confidence, that after reading the Fotonovela, people felt more confident in identifying the need for depression treatment, which is an important component for help seeking. We also found some impact on reducing stigma towards particular antidepressant medication. And what's interesting is that it was a short-term impact. So before reading the Fotonovela and after reading the Fotonovelas and being exposed to this intervention, people reported reductions in stigma toward antidepressant medication. But over time, 1 month later, that stigma continued to grow and actually came back. So the Fotonovela had a small impact on that, but it didn't sustain over time. Where it did sustain was a reduction on stigma towards seeking mental health services. So over time, from pre-post to 1 month follow-up, we saw that the Fotonovela reduced the stigma that people have towards seeking mental health services, and that reduction was sustained after a 1 month follow-up from the intervention, which is a really important component because it's reducing people's views, negative views of seeking mental health care. And then in our study, we also saw that there was an important difference on people more likely to share the Fotonovela than the brochure with others. In fact, we asked people what they did 1 month after they had read the Fotonovela, and many people have shared it with someone else. Many people have talked about it with someone else. And interesting, nobody has thrown the Fotonovela out versus the brochure. People did throw the brochure out. And this is sort of an indication that the Fotonovela was something people value and wanted to share with someone. And it's also a less stigmatizing tool that they can share. Our Fotonovela doesn't have a cover that mentions depression. It's something that can be shared with people. So in terms of where we're going with this work has continued to grow, and we've done this randomized controlled trial. What we're trying to do now is to incorporate secret feeling, to use this tool into existing services. So how to use this tool if someone is in an outpatient mental health clinic? How can they use secret feeling as an educational tool that people can use at the beginning of treatment? Or in primary care clinics, as people get identified with depression, can you provide secret feelings to them as a way to initiate a conversation on depression, to begin to discuss issues around help seeking, recognition, as well as reduce stigma? So there's a great team that has already completed this trial. Catherine Sanchez, who's at Baylor, and she's at Dallas and Dallas Fort Worth actually, and she's actually completed this great training or trial called Metric, and where she integrated the use of secret feeling as a tool to increase treatment engagement versus standard education. So what they did is a really interesting approach in which they did a universal screening at these primary care clinics in Dallas and identified Latinos that had depression. And if someone scored positive on the depression screener, the PHQ-9, then they were given either the Fotonovela and a discussion with a care manager about the Fotonovela, or just provided standard education. And then they were encouraged to seek care, to connect back to the clinic and come back to treatment for their depression. So it's an interesting trial that's testing whether our Fotonovela actually engages people into care and using the care manager as a way that people can read the Fotonovela and then ask questions about it. We're very excited about this because we see the Fotonovela as a conversational starter, as a door opener. People read the material and then they can have someone they can talk to about some of the concerns that they have, some of the issues that they might feel, some of the questions they might have about treatment, and the Fotonovela can be used as a way to start that conversation in a non-stigmatizing manner, and they can see it from the story that they're being exposed to. And so we're really excited to see what happens with this trial and see if there's any impact that the Fotonovela has, not only in improving knowledge, as we've seen, and reducing stigma, but seeing do people come back to care? Do they actually engage in depression treatment because they were exposed to the Fotonovela? So stay tuned because the results of the trial are coming out soon. We're also exploring, the Fotonovela is done in a pamphlet, so we're also exploring other media outlets. Can we put the Fotonovela on the web, on a radio, for wider dissemination? Can we develop sort of a YouTube video where we have the Fotonovela narrated or acted and provide another venue to disseminate this information? So those are important aspects. Some of the work that has been done for Fotonovela, they've done it in the radio. They've also done it in web. In fact, people have done it as dramatic skits that they can use for different communities. So there's many different options that we want to see here and see where to take the Fotonovela. And then we're also thinking of developing peer-led programs at multiple community settings where peer specialists or people with lived experiences with mental illness or community health workers can use the Fotonovela to initiate a conversation about depression in different community settings, sort of to provide sort of a more public education campaign around depression and taking the information to the community, to people to ask questions and stuff like that. And we think this is really important because one of the things that we know that reduces stigma is not only increasing knowledge, but also having a direct contact, a personal contact with someone who has recovered from a mental illness, and that actually is a great and effective way of reducing stigma, seeing that someone can actually overcome the challenges and receive care and recover from depression or other mental illness. So using peer specialists in this role as a community educator in a sense could be very a useful approach. So those are another component that we are in the process of exploring. And then, so in conclusion, what we are finding is that the message we want to actually talk to you about today is that depression is a real condition and it can be treated. There are great options of treatment out there. Stigma prevents Latinos and Latinas from seeking and engaging in care, and it's an important modifiable factor that needs to be addressed through interventions. And it's an area where more research is needed and more work is needed to improve care in our communities and access to care. And what we have here is an example of one tool that can be used to break the silence and provide practical information about how to seek help in the Latino community. We see this as one tool, and we think that there could be many other tools and opportunities for reducing stigma in the Latino community, and to do so in a way that is culturally appropriate, linguistically appropriate, and that engages people in this process. And what we hope that secret feeling is an example or a model that people can use for other conditions and other opportunities to engage our community in this. We think stigma is a major barrier, and we need to do a better job on reducing stigma in our community to improve care and hopefully reduce mental health care disparities. I do want to acknowledge, so none of this work is done in isolation. We've had some great partners throughout the years that have helped this work. This work, in many ways, been funded by the Office of Mental Health in New York, as well as other organizations. And then the collaborators, the team that have done this has been really good. Mel Barron and Gregory Molina from the University of Southern California, as well as Jennifer Unger, were the original team that developed this, and we're very fortunate to collaborate and partner with them. And in fact, if you're interested in getting copies of the Fotonovela or an example, let me know. I can put you in contact with Greg Molina, who's in charge of the distribution of the Fotonovela and the different opportunities. And then other collaborators that we have over the years, Roberto Luis Fernandez from Columbia University, been a great mentor and collaborator. And then this new collaboration we started with Catherine Sanchez and some of the randomized control trials. She's taking this work to a whole different level, and we're very fortunate to be part of that process. I do want to make you aware that we have some useful references if you want to follow up on some of this work. These are the references that sort of the things that we have published from this work. All the different stuff is out there, and I do want to particularly mention a chapter that we recently published on the depression Fotonovela that integrates all the work that has been done. And this is in the Handbook of Acculturation and Health, and it's a chapter that brings together all the work that I have basically presented today, and some future directions that we're taking this work. So check that out if you can. And overall, sort of that's all I have for today. I'm happy to engage in some questions, and I thank Darisa for the opportunity to present our work and contribute to the mission of this center, which is a critical technological center for our community. Thank you so much.
Thank you, Dr. Cabassa. We do have a few questions. So,
Sure.
Okay. So you mentioned reduction in stigma for medication. However, it wasn't sustained for a longer period of time. Have you or your team thought about possible factors that may contribute to the fact that for medication, the reduction wasn't sustained?
Yeah, that's a great question. I think one of the components, there's many factors actually that I think influence that aspect. One is a long-standing view of psychiatric medication in the Latino community, that people view these medications as addictive and that have negative consequences. And some of that is true. Some of that comes from people abusing certain types of medication. So some of it comes from views that people were taking other types of psychiatric medication, like, for example, sleeping aids and benzodiazepines that have addictive components. So some of our long-standing views that are hard to change. The other one is how people experience with these medications. That also comes into play. They start taking the medication, they might not feel better. It takes time for these medications to work. So all of that influences that long-standing view and stigma that people have. Psychiatric medication also come with side effects, so that is also an important aspect to discuss. So I think what we've learned is that the Fotonovela or a discussion on this issue can be directly addressed, that it is important to pay attention to people's views of medications as they're being introduced with medication, and to check up on people and ask them, how are you doing with your medication? Are you taking them? What concerns do you have? What issues are you facing? So that the clinician is more aware of what those issues are and can address them as they develop, because they are there present. And sometimes in our community, people don't, if do not ask them directly, they won't report it. So it's really important to have that conversation, and the Fotonovela can help start that conversation.
Okay, thank you. A second question is, were you able to determine differences within subgroups of Hispanic and Latino populations?
So it's a great question. We haven't done that work yet. We basically, the testing that we have done on the Fotonovela has mostly been done in the West Coast, in California. So in communities that are mostly of Mexican origin or Mexican background. So we've seen some impact there. There's some new work that, so the work that Catherine's doing in Dallas might be a bit of a different community, so a different state. And we're gonna see what impact does it have there. And we recently are working with a doctoral student at UCLA in the Department of Psychology, and she's doing her dissertation where she's comparing the impact of the Fotonovela between urban and rural Latino communities. I think it's between LA and San Bernardino County. So she's putting to test actually that same question. Does the Fotonovela work the same in different types of Latino community, not only different groups, but rural versus urban? And those are important questions to ask. Latinos are a highly diverse group. It is very important to consider that heterogeneity and to test, and actually to put that to test with different Latino groups. I think it will be very important, the next steps in this work.
Another question is, what role do you think language plays in terms of services and accessing services?
I think language is a major barrier to care. It's an important aspect to care. If people cannot communicate with their clinicians or with their provider on the same language, that becomes a huge barrier. So it's really important to take into consideration people's language needs and understand what how to connect to care. And this is a major issue in the work that we've done both in LA and New York. We still see language barriers in major urban centers where you would think that there's a high concentration of bilingual providers, but yet language is still a barrier for many people. So it's something that every clinician needs to assess with their clients, what language preference they would like, what needs they need in terms of communication, and then be able to provide communication. And if an interpreter is needed, to use an interpreter, even if the clinician thinks they're bilingual and have communication issues, sometimes an interpreter will work. In the work that we did in the Fotonovela, it was very important for us to have this material both in English and Spanish, and at a literacy level that is accessible to many people. So to us, it's not only the language, but the literacy level that people have. That also is important to take into consideration, particularly in mental health. These are conditions that take a long time to treat. They do take both medication and psychosocial intervention. So language is embedded in all of that. So it's important to make sure that the person understands and is able to communicate along the things and understand the concepts that are being used in treatment. It's another important aspect of language.
Thank you. So one question that has come up a few times is, how can our participants access secret feelings?
So that'll be great. If someone, maybe we can have send an email to us, because we basically, Greg Molina, who's at the University of Southern California, is the one that prints out the fotonovelas. We are happy to send out samples, so 1 or 2 copies for you to see it. We actually can send out samples via the web. I can email you samples, and if then people want to order, then Greg can put on an order and discuss with you different prices. The idea here, if you order by bulk, the cheaper it is, and we want the people to use the fotonovela, so there's different options for doing that. So if people want examples of the actual tool, we have PDF copies of that we are able to share with you, so you can see the actual story and things like that, and then decide whether you want to order some of this. And we don't make any money out of this, so there's no business that we're doing here. We developed this tool, and the idea is to disseminate the tool freely or at a very low cost for printing, basically.
Okay.
Or want to use it.
Okay, so maybe we can speak about having the samples available for our participants, and then whoever's interested, they can go ahead and order copies of them.
That'll be wonderful. Yes.
Okay, sounds perfect. Okay, so those are all the questions for now. So I'm going to go ahead and take the control of the screen again.
Sure.
So thank you again for answering the questions, and of course, thank you for agreeing to collaborate with us in this and provide the webinar, hopefully the first of many other collaborations. And so for our participants, this concludes today's webinar. Again, I would like to thank Dr. Leopoldo Cabassa and remind our audience that if you're interested in receiving further trainings, you may email us, like I said, at hispaniclatinомhttc@uccaribe.edu. So as you leave today's webinar, you'll be directed to complete a brief survey about your experience. So your feedback is very important to us, and we appreciate you taking the time to tell us what you thought of today's webinar. So thank you, everybody. Gracias, and hopefully we'll have another one soon. Thank you.
Thank you.